Ready to go?
Yeah.
Good morning, everyone. If you'd join me, if you could stand with me for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, Mr. Chair.
Good morning.
Good morning, everybody.
Good morning, everyone. The chair is not available this morning. I'm the vice chair. My name is Jeff Jelinski, and today is Thursday, December 8th. And I know it's Thursday because we weren't here on Tuesday. We did the pledge. I would look for a motion for, or first of all, I would ask, if there isn't any, I would look for a motion for the agenda.
Second.
Got a motion and a second. Is there discussion on the agenda? Hearing none, those in favor?
Aye.
And that motion passes. Our next item is item number 4 on our agenda is the approval of our consent agenda. I will ask the board if they've got anything that they want to talk about on the consent agenda, if they want anything pulled. If there is nothing, I will say that this is a roll call, and I'm going to start with Commissioner Wilson.
Commissioner,
Oh, excuse me.
motion in a second.
Oh, we need a motion. I'm sorry. Excuse me. Thank you.
I'll make a motion. Second.
You've got a motion and a second. Now, further discussion. I'm a little out of practice. Sorry about that. Commissioner Wilson. Lemire.
Aye.
Wincher.
Aye.
And myself, Commissioner Jelinski, is an aye vote. That motion passes. We're moving right along. We're going to move into item number 5, Health and Human Services. And Brad and Cindy are with us this morning. Good morning, Brad.
Mr. Chair. Good morning,
Good
Commissioners.
morning, Cindy.
Morning.
So this morning, we're going to talk a little bit about our family home visiting program, which is going very well. We use an evidence-based model called MESH, and Cindy's going to talk a little bit about how it's going.
Good morning. Thank you for hearing us today. A couple of years ago, we started the MESH program, and it's an evidence-based program that allows us the ability to train our staff in-state instead of them out-of-state. Evidence-based means that there's a lot of statistics and data that show that it's a successful program, and it is called MESH. Slide 2, please. So in the Minnesota Department of Health, there's some specific guidelines for a maternal child health program, and I won't read the whole slide to you, but the idea is that we are assessing families' needs, that we're taking that information to advocate for healthy development of families, and we're advocating for programs and funding streams that meet those needs. Next slide. Our focus is assuring outreach and coordination. So when a family is admitted to this program, we're also looking at a bigger picture. Are they in need of some food support? Are they in need of some guidance with regard to development of that child? As well as the medical things. Is that child on track with immunizations and well child visits? So it's a very inclusive. It's not just focused on one thing. Next slide, please. MESH, of course, is the program that originated in Australia, came here in the early 2000s. It is now being widely used by just about all of the counties in the state. There's been a great transition in the last 2 years to this program. It allows us greater flexibility. We're able to see more than just first-time moms because we know that not everybody is a pro just because they've already had one child. Every pregnancy and every child is different. It's a cost-effective program because we don't have that out-of-state travel expense. And it has a strong reflective practice element, and I really want to stress that. I feel like that's one of the reasons it's extremely successful. We're dealing with high-risk moms with a lot of challenges, from mental health to chemical dependency to poverty to a lack of education about parenting and encompassing a lot of things. That's hard on nurses when that's what you do day in and day out. And not every story has a huge success rate, but we have some success. So having an ability for those nurses to have some opportunity to reflect on that practice, to debrief, to look at how are other ways that we can do this with a professional, with a nurse that's trained in reflective practice. And the reason that I feel that it's so important is because that allows us to have good continuity of care with our nurses. If you get nurses that burn out because of the stress level, you don't have continuity and you don't have success. So keeping the nurses' cup full, so to speak, and reducing their stress by having reflective practice is a really big component to this program. Next slide. So currently, we've got 4 public health nurses that are staffing this program. One of them does just a little bit with WIC, and otherwise they're entirely focused on this. Again, it's pregnant moms and newly delivered mothers and their children all the way up to age 2. So that's a lot of early growth and development happening from birth to age 2. And a big focus is supporting their parenting, and it's really about supporting their partnership and relationship with their child. So if you can help that parent or parents to develop a good, strong bond and relationship with their child, their development is going to be much more on track. We work in partnership with a lot of people. It's not just the family home visiting nurse. We're interacting with people on the social services team, with people at Child and Teen Checkup, with WIC, with TCC, and other programs out in our community. So we're really helping these families connect the dots. It's not just that nurse visiting their home. Next slide, please. There's a few other little pieces that fall into family home visiting. The state sends us referrals on children and youth with special needs. So if there's a child born in our county that has a hearing or a vision or a disability of any kind, they make an effort to connect us to that family. And that's more about referral, making sure that from birth to age 3, when they show up for their preschool screening, that we haven't dropped the ball in getting that child connected to services. So those are things that we follow up based on reports that we get from the state. And then blood lead level reports. So any child in Morrison County that tests over a certain level for blood in lead in their blood, we get a referral on them. We follow up with that family, talk about possible sources, make sure that they're getting back in for rechecks, and then any amendment that needs to happen. So if a child is in an older home where there might be lead in the paint, any other sources of lead, that we get that under control. We average for the blood level, lead levels, probably about a half a dozen a year. The vast majority are not off the charts, but they're high enough that we do some follow-up. And our physicians in our clinics are awesome about making sure that those reports go into the state and come back to us. On rare occasion, when one is extremely high, we'll actually get a phone call from the doctor saying, hey, can somebody get out and take a look at what's happening here? And we usually can figure it out and get it under control. So there's a lot of interaction back and forth with our clinics and the Department of Health on those blood leads. Next slide, please. So the sources of revenue and our statistics, we've had some good success with getting grants to cover some of the cost of this program. It's never completely self-supporting. The cost for 4 nurses is obviously expensive at today's wages. So we do use some levy dollars, and if you can see, the first slide is our total revenue. The first 3 columns, the second is the expenses. And it looks like this year our expenses are up just a little bit over last year. We're doing more face-to-face, so we've got more driving expense, and so that would explain that. And our levy, because of the cost of wages, we continue to have to ask for a little bit more levy to cover the program. And the actual revenue, because of what we actually have to use for levy, continues to be in the negative. But we feel strongly that the work that's happening in this program is really, really important as far as getting these moms and babies on track. Next slide, please. So we get a lot of referrals, and they continue to be high, a little higher this year. The birth rate, I think, is up just a little bit. So we're at about 275 referrals. So that might be from a clinic, might be from a hospital discharging a newborn. It might be a referral coming from a school nurse saying, I've got a pregnant teenager. or just somebody, and from WIC, somebody who's coming into WIC who's pregnant or has a new baby, and we're getting those referrals from a lot of places. And we're on track to admit pretty close to the same number of clients that we admitted last year. Unfortunately, all of our nurses are at full caseload right now, and so we've actually had to start a prioritizing and a waiting list. So we're looking at high-risk babies coming out of NICU that are in need of services, or a high-risk pregnancy that are our first priorities. Unfortunate, I hate to have to do that, but we can only carry so many cases. And as quickly as we discharge somebody when they reach age 2, we're filling that slot with another person that's coming in. Next slide, please. So our sources of revenue, we get $63 a visit if it's not evidence-based, and $140 if it is an evidence-based. So 3 out of our 4 nurses are trained to do the evidence-based model, and we're waiting for the state to let us in with that last one. So they've really upped the game with the evidence-based. That's a much better reimbursement. Right now, we're at about 75% of our visits are evidence-based. We get a small amount of revenue for those folks that are on the birth defects and follow-up. It runs about $2,000 a year to do that work. Grant funds that cover expenses above the reimbursement from the client. So our grant, I think you can go to the next slide. One more. There we go. So our Strong Foundations grant is ending at the end of this year, and we did qualify for another Strong Foundation grant. So what happened is the state gave us, as a CHB, a total of 44 client slots for the 3 counties. 18 of those will be allotted to Morrison County. So we basically get $7,000 per year for each of those 18 clients to carry out that work. So the rest of our other roughly 65 clients are not in this particular grant. They typically offer opportunities for grant every couple of years, so we could possibly add another grant onto this. So this is covering some of our costs, but not all of it. It was a fairly competitive grant, and they really want us to keep our caseloads up for the whole CHB. In Morrison, we have not had any challenges doing that. Obviously, we're all at full caseloads. Because of the pandemic, the other 2 counties in the CHB did struggle a little bit more to keep their caseloads up. So we're hoping that if all of us can keep our caseloads high, that we'll be eligible for more grant dollars in the next round of grants. And next slide. So just to summarize, you know, we're doing a significant amount of support for our pregnant and postpartum moms and babies. It continues to be an educational program that talks about positive parenting and development. There is a little bit of a nursing component. Baby gets weighed and examined, but our intent is not to go in and do full exams on babies. If there's an ill child, that's what the clinic is for. This program is about teaching, parenting, education. We continue to have strong referrals from our hospitals and clinics. I just say kudos to our nursing staff that we're able to keep our caseloads as high as we are. The fact that all of our nurses are at full caseloads tells me that the clients that we're serving like the services that they're getting, and they stay engaged. We have very few that don't stay on the whole 2 years. So that tells me we've got some good work happening there. And then the Department of Health does rely on us to gather a lot of data. So our public health, our PHDoc system, as the nurses are charting and entering their notes, a lot of data is gathered from that system. It interfaces with the state literally on a daily basis to upload data. So that data drives the dollars coming from the state when they can see the work that we're doing and the outcomes and the successes that we're having. That allows us to qualify for more grants down the road because they can see that we're doing the work that we say we're doing. And next slide, I think, is just questions.
You know, I would just like to add that really home visiting is kind of at the core of prevention. When you're talking to families shortly after giving birth, they're trying to soak in information on their new child and what they should do and how they should do it. And so it really is kind of at the core of prevention and is a critical service.
One of the things that we see happen is, the nurses spend a lot of time preparing for their visit. Okay, I'm seeing a 6-month-old today. What should they be doing for development? What should I be teaching that parent? Having all of that ready. And then on the fly, the nurse goes out there and there's some other crisis. It might be a housing crisis. It might be a mental health issue. It might be even abuse, whatever. And so our nurses are very skilled at being able to change gears and meet that client where they're at, because that day they're not going to be receptive to the education that you might have planned. They've got a different crisis, and that early intervention is so important.
Certainly. Questions from the board? Go ahead. Go ahead, Randy.
Thank you. Anyway, this is income-based, I'm assuming, right? Because
It is not the only qualifier. We actually look at a bigger picture than that. We look more at what their risk factors are. And typically, someone who is at the poverty level or below is at higher risk in general. So if there's a mom out there that's not in poverty but is struggling to parent, they still qualify.
So if I'm, my wife and I have decent jobs, good income, and we're struggling with a child, we could come in there and.
Absolutely. And so then you might have insurance that will help defray the cost of the services that you're receiving. We bill insurance, but if the insurance doesn't pay anything, we still continue the
And that's great
services.
to know, because most of our programs are income, based on that, where
Yeah.
this one is not.
It's more about their risk level.
Parents in all walks of life struggle from time to time as parents.
There's no book that says that you wouldn't become a parent for
Yeah.
the first time.
And I need to thank you for that, because I have the same thing written down here. Qualified financial. There's not one person that I'm aware of in this country, parents, that have any clue that their child is going to be special needs. And that's where I was coming from through exactly what Commissioner Winchester said, was it doesn't matter how much money you have, your child has special needs, they have special needs. And my question to that is, and I believe it was just answered, we support that, those
Absolutely.
folks also, those
Absolutely.
children. Very good, I
Yep.
appreciate
And
that.
a lot of what would happen with a special needs child is really a lot of connection, making sure they're connected to what other resources are available out there, because there's a lot of them, and it's overwhelming for parents to, where do I start?
And that's a key piece, that regardless of who we are, we don't know what services are available. And then when you talk about adding a special needs child in there, never having to dealt with it, being able to support them and give them resources is important.
So my assumption is that at birth, perhaps, that mother, that father, those parents are given information? How would I know? How would we know? How would anyone know that we have an issue, a special needs, let's just say, that I now can turn to the county, if you will, for help?
Typically, the hospitals send us referrals on
Okay.
those folks.
Okay.
They are also reporting things to the state, so we're getting a referral back from the state. And then sometimes those things aren't real evident right away, and so then screenings, the ages and stages questionnaires, and when a child starts to fall behind, then we get referrals.
You don't have to have a referral, though, correct? Or-
Correct. Anybody can call. We get a list of all the babies that are born to parents residing in Morrison County. So if they're born at Essentia and Brainerd or Lakewood or St. Cloud or here in Little Falls, we get a birth report and we send a welcome letter to all of those families.
Perfect.
Saying these services are available. So we don't know from that list always what their risk factors might be.
Perfect.
We're offering it.
Go ahead, Mike.
Do you also assist probably the same individuals with their pre-birth?
Yes, they can,
taking
they're
care of?
eligible, so the clinics send us lists of all the pregnant moms. And ideally, we like to connect with them during pregnancy, because there's some preparation, 3 or 4 visits before baby comes. And then you can identify if somebody is struggling with housing, somebody, maybe they can get hooked up with WIC, because that's a program for food support during pregnancy. First-time moms, especially preparation for labor and delivery. So yes, ideally, we like to catch them during pregnancy, but not all come in that way.
That would be the greatest scenario, is
Yes.
you're already prepared for that person, whether it's a mental health issue or a housing issue.
Exactly.
Thank you.
And
Anything? Go ahead.
My last question, Mr. Chair, is that this program is, and again, Morrison County does a great job with, getting this out there. But if I'm in Todd County, Stearns County, this program is available through all of them.
Absolutely, and sometimes we've got moms that are mobile, and we just had one that I can tell you was an amazing success story, that a very young teen mom that was in an incredibly awful situation at home with unsafe surroundings and a lot of illegal activity going on around her, and we didn't know what was gonna happen with this situation, and that child is now 6 months old, and we've got that mom to a point where she felt strong enough to move out. And she found housing in Sherburne County, and we transferred that case to Sherburne, and a nurse is following her there. But we just saw amazing success with that program, but it was a lot of working hard to connect her to resources and getting her out of a bad situation into a safe place. And I don't know that that would have happened without that nurse.
Mike?
Does that, does the funding for that particular individual there, does that still come from Morrison County then? Or
It does not,
it
nope.
reverts to Sherburne
Yep.
then?
My questions have been answered.
Excellent. Anything further from the board?
Great information.
Thank you very much, Cindy. It's always a pleasure to have you come.
Thank you for your support for the
Thank you.
program.
Thank you. All right, Brad, you got another item, don't you?
The next item is also, excuse me, related to home visiting, and part of the model includes mental health consultation. And so we contract with Jessica Nemi from Lakes Country Associates to provide the services. So looking to approve this contract with an addendum, because of how we are adjusting services for the next 2 years because of time. She's asking for a rate of $175 per hour for clinical supervision and $90 an hour for travel. This contract is split between the 4 counties, so we each pay 25% of this service. Our nurse meets with her eight times a year, and then they do a group supervision 4 times a year. So looking for approval for this contract, which is a 2-year contract.
Make a motion to approve, Mr. Chair.
Second.
Got a motion and a second. Do we have further discussion? I'm assuming, Brad, that this is a program that is another success program.
This is really what provides the support for those nurses in those difficult cases.
Okay.
You know, when you talk about, young parents struggling with mental health, or maybe a child with developmental issues, this is who we can use when we have to work through some of those challenges.
Okay,
Mr. Chair.
yes?
Just a clarification, Brad, I think you said $175. I think
Yep.
it says $150.
Yep, so I would amend the contract to say 175
Okay.
and 90
I
for
didn't hear you
travel.
say that.
Yep,
All right, sorry about that.
no, that's okay.
Further discussion from the board? This is a roll call vote. Commissioner Wincher?
Aye.
Lemire?
Aye.
Wilson?
Aye.
And myself, Commissioner Jelinski, is an aye vote. That motion passes. Thank you.
Thank you. I don't have anything else, but I'm just here also to request the ability to replace Sarah Pratt. I understand the administrator shared that with you. Well, as sad as we are, it's thrilling to have somebody move up. She's going to be the new director in Aiken County, and so would like to replace that position, and then if anybody internally gets it, just to backfill that position, unless we decide it might not be needed or something of that nature, but I don't see that happening. But would like to start by replacing Sarah.
I have no problem, Mr. Chair.
Get her replaced.
No problem.
When's our last day? Or
December 27th.
Take care of it,
So,
Brad,
yeah.
and I agree with you. You know, to have anyone from internal, we never like to see any of our employees leave, and I get that. But she's taking a big step, going to another agency, and God bless America.
Yep.
Good for her.
Yep, professional growth at its finest, so.
Absolutely, absolutely.
Thank you.
Thank you both. All right, Land Services. I see Amy brought a partner with her today. Darren, you don't get to come to the board very often. I appreciate it. Good to see you.
Good morning.
Good morning.
We just have one thing for you today. Your RBA says that we're gonna recap the 2022 aquatic invasive species season, and then also ask for approval for the 2023 aquatic invasive species plan. I'm going to save the 2022 recap for my annual report that you'll be seeing in a couple of weeks. So what I'm asking today is consideration of our 2023 Aquatic Invasive Species Prevention Plan. That is a required plan that needs to be annually updated and approved as a condition of the funding. And I brought Darren along if you have any questions.
Mr. Chair?
Sure, go
I'll make
ahead,
a
Mike.
motion to approve.
Pardon me?
I'll make a motion to approve.
Okay, got a motion on the table. Is there a second?
Second?
Got a motion and a second. Further discussion? Commissioner Wincher.
Thank you. Again, looking at this, I understand it's a plan.
Yes.
But there's, must be down the road, or did we approve a dollar amount for each lid or something? Wasn't there, this has nothing to do with that at this time.
No, so this plan is really outlines what we're going to accomplish or the focus of our aquatic invasive species program. A facet of our program then is that grant program, which we have budgeted for 2023.
Thank you.
So the program that we're talking about right now certainly has a dollar value to it somewhere, I assume.
We have the annual funding that we get from the state, and that is the money we have to work with to put towards this plan.
But we're really not talking about that. We're talking
No.
about the program right now. And Darren this is your program,
This is the outline
Yes.
for the program.
of your program. So what do you have to say about it? Anything? Plus, minus, good, bad, ugly, indifferent?
Very similar to what we've done in the past.
Okay.
Very minor updates for the plan.
Okay?
I wanted to clarify, this is an annual plan that we do every year, and that it's part of that grant process, a requirement for that grant process.
Okay.
That's correct. So when we do have that grant program, we require those applicants to identify what work within the plan they are furthering or complementing, so.
Okay. We've got a motion, we've got a second. Do we have further discussion? Hearing none, this is going to be another roll call. Commissioner Lemire.
Aye.
Wincher?
Aye.
Wilson?
Aye.
And myself, Commissioner Jelinski, is an aye vote. That motion passes. Thank you.
Wonderful. Thank you.
both
Have
very,
a
very
wonderful
much.
day.
And please, Darren, you can stop in anytime you want to. It's not always just Amy.
Don't do that, because this is just gonna be hanging out down here.
Thank you both
Thank you.
very, very much. All right, our next item of business is going to be our administrator's report.
Thank you, Mr. Chair. I wanted to provide the board an update where we are with our union contracts, and then I will ask the board to approve an RBA, and I'll explain that. But in order to ensure that our payroll doesn't get messed up as we close out 2022 and we get ready for 2023, timing is key. And I'll elaborate on that here in a minute. So as an update, we have 5 unions in Morrison County. All 5 union contracts expired at the end of 2022. And we have been working diligently to seek a contract for 23 and beyond. So for our 5 union groups, our corrections officers in the jail is complete, adopted by both the union group and the board, and I believe that was last month. Our deputies have ratified the proposal by the county. The deputies have all signed the contract, and that contract is here. And upon approval by the board today, then that will be signed and endorsed, and then we'll have a contract for the next 3 years. The dispatch union group has ratified the offer by the county. And we are completing the updated language to the contract and a red line version. That was viewed by the business agent yesterday, and we had a conference call between our HR manager, myself, and he, and believe that that is going to signature, which gets to why I'm bringing this RBA. And that will be similar to the next 2, which Public Works, I got word yesterday morning that they have ratified the offer by the county as well. So they have approved the offer that the county has made. Now we will do that red line version, update the contract, the language, and then we'll get it back to them for review and signature, and then I'd bring it to the chair to adopt. And then Health and Human Services have had great interface with their business agent and with the board's endorsement have proposed an offer. They will vote on that on December 14th. I'm optimistic that we've addressed the union group's concerns and have made a fair offer to Health and Human Services. So there's a list of summaries of changes in your packets today, and this RBA that I'm asking the board to endorse says that you will allow to approve the union contracts with LELS deputies, LELS dispatch, and AFSCME Public Works and Health and Human Services for 23 through 25 year upon ratification endorsement by the union with the proposed summary of changes. So the summary of changes we've talked about in depth. We've covered them. They are accurate to what the board has approved and endorsed. Now, in order to not lose time as we have our intermittent meetings, I believe these next two will conclude this week, and then the Health and Human Services the week after. So with this RBA, that'll allow the administrative piece for the signing. Now, if one of these union groups leaves the summary of changes or what the board has agreed to, that nullifies this RBA, and we would bring it back to discussion in the process.
Absolutely. Gentlemen, we've heard what the administrators said. We've heard the request. I'd look for a motion.
I'll make that motion.
Got a motion, is there a second?
Second.
Got a motion and a second, is there further discussion?
Mr. Chair,
Yes, go ahead.
this is for Administrator Law. Are you wanting to vote for all of these on one motion?
That's correct.
Would it be possible to take out the Health and Human Services portion so I can abstain from that
We can do
portion
that.
of it, please?
And if that's the case, then we'd show two motions.
Two motions.
Okay,
We'll amend the RBA to remove Health and Human Services as is proposed here, and that'll be the first one we'll address. That will be a vote for deputies, dispatch, and public works.
and the purpose behind that, Commissioner Lemire?
Is, my wife works for the Health and Human Services Department.
Absolutely. I would have zero of an issue with that. Further discussion?
It'd be a conflict of interest.
Yep, thank you. Further discussion on the motion?
First motion is the three.
First motion is to approve the following union contracts for LELS dispatch, deputies, and AFSCME Public Works for the 23 through 25 term upon ratification endorsement by the union with the proposed summary of changes.
Again,
Thank you.
questions? Go ahead.
I'll amend the motion that I made to go along with our administrator.
Excellent.
I just would like to make a comment, if I may, Mr. Chair.
Please, absolutely.
I just want to thank Administrator LeBlanc for all the work he did with this. This was a lot of back and forth, a lot of meetings, and I'd also like to thank the unions, because, we didn't agree on everything, but we did compromise on a few things, and we got a contract that I think we both can live with, and there's no hard feelings on either side.
It's working together, getting things done.
Yeah.
And that truly is what was done here, so. Further comments?
Yes, Mr. Chair, and again, to follow up with Commissioner Lemire, I've talked to some other counties, they're having a difficult time ratifying their contracts with their union. And again, I commend our administrator, the county board, the staff, and, that we all work together. And this was a tough process, because again, we have 5 unions come and do it at the same time, which does not happen too often. So again, thank you for everyone that participated in get this taken care of.
Further comment?
I would agree with what the other two said. They just said it, so I don't need to, but I agree with that.
Excellent. And I also agree. All right, gentlemen, we have a motion, we have a second. This is going to be a roll call. Those are all in favor. Commissioner Wilson?
Aye.
Lemire?
Aye.
Wincher?
All right,
And myself, Commissioner Jelinski, is an aye vote. That motion passes. Our next motion will be,
Next motion is to approve the following union contract for AFSCME Health and Human Services for 2023 through 25, term upon ratification endorsement by the union with the proposed summary changes.
I'd look for a motion.
So moved.
second.
Got a motion and a second. Further discussion? Gentlemen, the discussion, as far as I'd be concerned, is the exact same discussion as we just got done having, other than removing Commissioner Lemire, if you will, from the vote. Anything further? All right, this is also a roll call. Commissioner Wincher?
All right,
Commissioner Wilson,
Aye.
and myself, to abstain, Commissioner Lemire,
Abstention, please.
and myself, Commissioner Jelinski, is an aye vote. That motion passes 3-1 with Commissioner Lemire abstaining. And there we are. There we have it.
And that's all I have for the board, Mr. Chair. Pending any questions or anything that the board is looking for, you want me to gather up prior to our next meeting? I know we're going to talk committee reports, but again, truth and taxations
Yep.
this evening, but anything else for me?
Anyone have anything for the administrator?
Is our next meeting a meeting or a planning? You know?
Planning.
Well, sure, we will know.
Our next engagement is, today is the 8th, the next engagement is December 13th, it's a planning.
Okay.
And then we'll be back for board on the 20th and back for board on the 30th, the last day of the year, the calendar year.
And gentlemen, if you take a look at your schedules, what we're going to do today is we're going to go from the 11th through the 31st. And if it's all the same to everyone, I'll get it kicked off. On the 13th, at 7:30 in the morning, I'm going to be joining the National Wild Turkey Federation and delivering turkeys at the Little Falls Food Shelf. At 8:30 in the morning, we will have a planning meeting. We did have a scheduled Planning Commission Board of Adjustment, but that has been canceled. The 14th, at 11 o'clock in the morning, I have a Central Minnesota Emergency Services Board Executive Committee meeting, that's virtual. At 8:30, there's also a department head meeting. At 3:30 that afternoon is a State Emergency Communications Board Executive Committee meeting. And let me just take that back because that was changed, that was actually held yesterday. The 15th, 10 o'clock in the morning, Central Minnesota Emergency Services Board Owners and Operators Users Committee meets virtually. At 12:30, that same day, the State Emergency Communications Board will meet virtually. The chair will not be available. I will chair that meeting. At 6 o'clock that evening, there's going to be a holiday gathering at our administrator's residence. On the 16th, at 10 o'clock in the morning, I have a Central Minnesota Emergency Services Board Joint Powers Board meeting. That's going to also be virtual. On the 20th, at 9 o'clock in the morning, we have a county board meeting here in the boardroom. On the 21st, at 9 o'clock in the morning, there's a Central Minnesota Emergency Services Board Executive Committee meeting. At 1 o'clock that same day, the full board of the Emergency Services Board for the Central Region meets. 5 o'clock that evening, there's a Hands of Hope meeting, and that meeting is virtual. Okay, 23rd, 24th, 25th. The 26th is going to be the Christmas holiday observed. This building will be closed. On the 27th, at 6 o'clock in the evening, there's a Planning Commission Board of Adjustment meeting. And on the 30th of this month at 9 o'clock in the morning will be the final board meeting of the year. We will take care of whatever business needs to take care of by the county board. And that is all I have on my schedule as it is right now, Commissioner Wincher.
Okay, the other boards I serve on, they're not for sure if they're gonna be, having or canceling that, like TCC, I know will be canceled. Soil and Water, they haven't decided whether they're gonna be, exempt from doing that meeting, otherwise,
You might as well give Soil and Water then, just as if it was happening.
yeah, okay, then Soil and Water, then would be yeah, see, it won't happen on that day, I know that, because it's supposed to be on the, I just lost my. It's supposed to be on the 23rd, I don't think they'll have it on the Christmas Eve.
Okay, not a problem.
I'm not for sure.
Okay.
What they'll be doing there, so.
But you
Otherwise,
said TCC?
TC is definitely canceled. In Great River Regional Library, not for sure, so they haven't kept us up to date whether they're gonna have the meeting or not.
What
Good
date
enough.
would that have been?
The Great River Regional Library would it be, Tuesday the 20th.
Okay? Commissioner Lemire.
On the 12th, Yellow Ribbon, 3:30 at the Legion. On the 27th. Did you get that cake reception, Jeff?
Yes, I think is that all that's gonna happen that night?
No, there's a BOA meeting and a planning commission
And I
meeting
didn't say anything about cake reception, but please go ahead.
right after for a retiring board member.
Yep.
28th, tentatively, HRA at 900. And that's it.
Commissioner Wilson.
On the 15th, I got airport at noon at the airport. On the 16th, I've got Mississippi Headwaters in Walker. And on the 20th, 10 o'clock. And on the 20th, I got community development at Pine Country Bank at noon.
Okay,
If I may, Mr.
Yes,
Chair,
go ahead.
Did you bring up tomorrow, that, for the,
I didn't talk
Ballroom
about,
in,
that would have been last time.
would have been, okay, yeah, you're right, yeah.
Would have happened, that would have been last time.
All right.
Anything further from the board?
None for me, Mr. Chair.
Good.
Do we need to, I'm sorry, are we going into closed session?
Mr. Chair, I put that in the packet as a placeholder. If there had been questions, it was ready to go. I don't think it's necessary, and
I
unless
agree.
the board feels the need to go into it, but,
And I will look to the board, is there a purpose, a
Aye.
need for that? Okay,
Our administrator gave us a great explanation.
phenomenal report on all of that. Gentlemen, is there anything further that needs to come before this board? If there is nothing, and I'm hearing nothing, I'm going to adjourn at 9:41.
Jeepers, we could tell us that someone else